The idea behind prophecy is precision medicine, is identifying biomarkers that may identify men with metastatic prostate cancer that will benefit from standard of care therapies. As you know, the first-line therapy in men with castrate-resistant prostate cancer is abiraterone and enzalutamide, but those drugs share cross-resistance mechanisms, and one of those mechanisms is a molecule called AR-V7. It's a splice variant of the androgen receptor. When that splice variant is present, the tumors do not respond to these drugs. And so we've developed an assay in conjunction with academic and industry partners to study AR-V7 in circulating tumor cells. And the prophecy study was a multi-center validation study of AR-V7 in circulating tumor cells. This study was funded by the Prostate Cancer Foundation in November as a challenge grant, and it was conducted through the Department of Defense Prostate Cancer Clinical Trials Consortium. We involved 5 centers, 120 patients, 5 central labs. It was a labor of love. It took about 4 years to complete. And on Monday night, I'll be presenting those results, which basically validate AR-V7 in circulating tumor cells by 2 different methods. The Johns Hopkins method, which is an RNA-based assay of circulating tumor cells, and the Epic Sciences method, which is a circulating tumor cell protein biomarker. Both assays actually performed quite well in predicting the response to this 120 patient cohort of patients treated with standard of care therapy. It predicted response, it predicted progression-free survival, and most importantly, it predicted overall survival. And so the implications of these findings are that patients where the doctor is trying to consider a second-line oral anti-androgen therapy or an alternative such as radium or docetaxel chemotherapy or a clinical trial now has a precision biomarker that they could order. And the idea is to move this work right into the clinic so that doctors could have this for their patients. So measuring circulating tumor cells has been important for prognosis, and we know that the more circulating tumor cells that a patient has in the bloodstream, the worse the outcomes are. Yet those numbers don't predict whether a certain drug will work. And that's why most doctors in the United States, United Kingdom, around the world are not ordering a circulating tumor cell test. And what the prophecy study does is it goes beyond just counting those cells, but measuring the tumor biology within those cells. So even after adjusting for the number of cells and other factors that report on disease burden, these markers still predict the outcome. And thus the prophecy was fulfilled, the outcomes were predicted. There are a number of patients that still are not responding to these drugs where they don't test positive for AR-V7. So we still have a lot of work to do in the prophecy study. We collected a wealth of DNA and RNA biomarkers to understand why the patients that lack AR-V7 may not respond. And so this is a good first step. A positive test really indicates a lack of benefit from these therapies. Patients should consider alternative approaches. A negative test does not guarantee response. So more work needs to go into precision medicine approaches, sequencing to understand how tumors evolve over time.